Good morning, I'm Dr. Paul from Amara Aesthetics, and today's video is about tear trough filler. I need to do a video about tear trough filler to explain exactly how it's done, how long I've been doing it, how it works, and those kind of questions. So tear trough filler is a treatment where you treat the under eyes with a small amount of dermal filler. The dermal filler is injected into the side of the nose and then some at the side of the eye to soften the deformity in this section. A lot of people need tear trough filler from the age of maybe late 20s to mid 30s. That's when you start to notice that the hollow happens, but sometimes people will have a hollow in this section from childhood. The hollow that forms as you get older is at the side of the eye. So kids don't tend to have a hollow here. Kids tend to have a hollow sometimes in the center, but as we get older we get a hollow here. So when I treat the tear trough, it takes about 5 minutes. You don't need a numbing cream. You lie on the bed. This is my clinic here. This is the bed that you lie on. You lie on the bed, then I clean the skin first of all. Then I do a few injections at the side of the eye, 2 or 3 injections. These ones can bruise. You've got about a 5% chance of a bruise in that section. After that's done, I'll use a cannula which needs to go into the center area. So to inject into this area, I have to make a needle hole here. Then the cannula can go up into this section and put a small amount in here. The most important thing about tear trough filler is the fact that the tear trough is a super sensitive area. So if you overfill it, if you put even 1% more than what you're supposed to put in, you can get a lot of fluid in there. The area is hydrophilic, meaning it loves water. So if you put too much water into the section, it will draw if you put too much filler into the section, it will draw a lot of water in. So you can end up only putting in 1% too much, but it can look like you've put 20% too much because of the nature of filler being hydrophilic and the way that area works. It's a very sensitive area. So the biggest mistake that beginners doing tear trough fillers, and I've been doing them for over 10 years at this stage, beginners doing tear trough fillers, the biggest mistake they make is putting too much. They want to get a great result for the patient on the day, so they'll really go hell for leather to try and make it perfectly flush. But if you look at a normal person in their 20s who's never had fillers, they tend to have a small hollow in this section. So really it's not a good idea to get rid of every last bit of a hollow. It's a good idea to leave some deficit there so that it's more natural. You don't lose out on any kind of gains by doing that. If you do a small amount, it means that it's much more natural. So I think that's all I can think of to say about tear trough filler. Please ask me any questions you have in the comment section below. Thanks for watching.